Okay, welcome to this very abbreviated segment of the Independent Doctors of Pahrump. I had a little difficult time getting out of the office, and I guess you were watching a previously recorded session. So either you got bored with that session or you turned it off. But if you had a question hoping to get that in, we do have, I think, 15 or 20 minutes left on this show. I guess it's better to have some new live information as opposed to just watching a pre-recorded show, even though I do hear some of the patients telling me that they're watching the old shows and they're actually getting information that they missed the first time. So, and that's true with just about anything. Every time you hear it again, you hear something you didn't hear before. So that call-in line is 727-8750. We have a few minutes left. I don't know if Ray is watching or some of the other people, but I happened to be out the other day at the O'Reilly Auto Parts, and one of the gentlemen recognized my signature, and his name is Day, D-A-E. So I'm going to say hi to Day if he's out there. So Ray, are you on the phone?
Yes, I am. I waited patiently, and I saw that you showed up the last minute, so welcome back.
Thanks.
Hey, I got a question. I'm 71 years old, and I've been having a problem when I bump my arms. That's the only thing. It seems like I get bruised real easily. Is that hereditary, or is it a vitamin deficiency, or is it diabetes, or what could that be? You know, the red spot for just a small bump or whatever. If you could explain that, I'd appreciate it, because
Sure.
It's kind of annoying, you know.
Well, the term for that is called senile purpura, spelled P-U-P-R-A, which is a term when you bleed underneath the skin. Whenever someone has a rash on their skin, it can be what they call a blanching rash, which means you press on the skin and the redness goes away, because that's an engorged capillary bed, usually with urticarial or allergic reactions. And then purpura is the term when you actually bleed under the skin, and in a younger patient, that's a very ominous sign. That's a vasculitis, when the actual blood vessels are rupturing and you're bleeding under the skin. As we get older, we lose the elastin in our tissue, so therefore because our skin becomes less elastic, the capillaries will break rather than bend. That being said, doesn't take much, a little bump, and you'll get these, red spots as you start to bleed underneath the skin. So it's unfortunately a really bad three-letter word called age, and as you age, you lose elastin, and you will have these little spots. So it's not a vitamin deficiency, it's not diabetes. However, if you are on a blood thinner, such as Coumadin or any aspirin or any type of antiplatelet therapy, those will become much worse and much more spread a lot worse. The other thing that you see sometimes is that people will actually, their skin will tear a lot easier. Same issue. If you happen to take cortisone or use cortisone products because of asthma, COPD, or things of that nature, you will probably noticing your skin becoming even thinner faster, because it is a vasoconstrictive type agent. So once it sets in, it's very difficult. All you can do is try and eliminate the bumps and the bruises, and that probably will take that. So as always, Ray, that's a really excellent question, and appreciate those calls. They always spark.
Let me give you a follow-up here. Is there any reason why it only happens in my forearms and my hands, no place else on my body, just when I bump it? Is it, are they particularly sensitive, the arms and the forearms and the hands?
Well, you may have had some sun damage to those when you were younger, and that may have caused a little bit more of a scar tissue. The arms and hands actually encounter most of the trauma in our body every day too. So they're the most active. They're the things we're bumping into, and also there tends to be a little bit easier for us to have tears over bony prominences than non-bony prominences, just because of the amount of fibrous tissue attached to the bone. So again, those factors usually have a lot to do with it, meaning the skin is looser in other areas, so therefore the skin will not give as much, so it will tear, and that's probably the reason why.
Makes sense, and thank you very much. It was very Very good to see you on the air again. Thank you. Have a good day.
Thank you. And I try and make it as often as possible, but it's been kind of crazy.